is the QT interval here. So the QT interval represents a single ventricular cycle of contraction and relaxation. So one cycle of this. If you recall from the previous letters of the cardiac cycle in which each one of these represent that we've already discussed, this tells us exactly what the QT interval is describing, right? So the Q, for example, of the QRS complex represents the beginning of ventricular activation and contraction. Remember, the T wave represents ventricular relaxation and repolarization. So when we take these together, the QT interval describes the time that this entire process takes, right? Now, speaking of time, what are some of the acceptable intervals for this measure? Well, broadly speaking, the QT interval should be less than half of the R to R interval, which is representing one ventricular contraction to the next. More specifically, though, the QT interval should be less than 0.44 seconds in men and less than 0.46 seconds in women. Now, women are known to have longer QT intervals when they're corrected for rate as compared to their male counterparts, even though the mechanism's not fully understood. Fortunately, it's not an absolute predictor, though, for cardiac arrhythmias and sudden death. Now, long QT syndrome may be hereditary. It could be electrolyte-induced or it could be drug-induced. In fact, medications with antiarrhythmic properties like sotalol, flecainide, amiodarone, and some others have the potential to actually prolong this interval. Patients that are undergoing loading therapies, for example, for these types of drugs often have their QT intervals monitored using serial ECGs. Now, if you notice a QT interval that's approaching or exceeding 0.5 seconds or half a second in these patients, you should definitely notify the provider. If left untreated, long QT syndrome predisposes patients to a potentially lethal form of ventricular tachycardia known as what? Torsade de poids, right? We talked about it a couple slides back. Again, remember, this can occur with a long QT if a PVC or other early beat were to strike the T wave when the ventricles are in their refractory state. There's the word again, refractory. So if this happens, the heart is thrown into that electrically chaotic state that we talked about, where cardiac output may fall dramatically if this were to happen. Now remember, cardiac arrhythmias are all about the effect that they have on total cardiac output. So on the next slide that we have here, you'll find a list, not a conclusive list, but a list of medications that are known to commonly prolong the QT interval. So always be on the lookout for these, okay? So the way I like to remember some of the most common ones that you may be giving as a nurse or other healthcare provider is the mnemonic Shazam. So sotalol, which is one of our beta blockers, that also has antiarrhythmic properties. Haldol, amiodarone, another antiarrhythmic, ziprasidone, azoles, which are the common ending for some of our antifungal medications, as well as macrolide antibiotics. So azithromycin, erythromycin, clarithromycin, and so on and so forth. So our take-home points for the QT interval are: the QT interval is representing a single ventricular cycle of contraction and relaxation. Remember, the QT interval should either be one of three measurements. Number one, it should be less than half of the R to R interval, remember, from ventricular contraction to the next ventricular contraction. Or, number two, it should be less than 0.44 seconds in men or less than 0.46 seconds in women. But typically, if we just remember 0.44, then we should be safe there. And the reason why is I'm going to show you an easy way to remember all of the measurements of this cardiac cycle in a few slides here. Long QT syndrome, remember, predisposes patients to a potentially lethal form of ventricular tachycardia known as torsade de poids. And finally, long QT syndromes may be hereditary, they could be electrolyte-induced or drug-induced.